Welcome to Hello Doctor Talks. Today we are discussing about the root canal treatment. To clarify doubts and myths about root canal treatment, we have with us Dr. Mir Rahil Mustaba, MDS in Conservative Dentistry and Endodontics, member of Indian Association of Conservative Dentistry and Endodontics, as well as Telangana State Dental Council, root canal specialist and aesthetic dentist with a wide experience in microscopic endodontics, episectomy dealing with calcified teeth, curved canals and radix endomolars cases. Doctor, what do you mean by dental caries?
So dental caries basically means a decay caused in the tooth by microorganisms. Many people, especially in rural areas, have this misconception that dental caries means worms in the tooth or something similar to it. But in reality, it is microorganisms which are not visible to our eyes. So these microorganisms end up decaying the tooth. So this is a healthy tooth. It has three basic layers: enamel, dentine and pulp. Okay, so the caries start all the way from the enamel, and if not treated, they extend up to the dentine and eventually in the pulp. And once they come to the pulp, they start causing pain. And this is when we need a root canal treatment for the tooth. As long as the caries are limited to the enamel or dentine, we can restore it with a simple restoration or filling.
Doctor, what is root canal treatment?
So root canal treatment is a procedure wherein we clean all the caries of the tooth, and then we go inside the canals and irrigate and thoroughly disinfect and try to sterilize the canals, and then we fill it back and close the tooth. This helps in restoring the natural tooth and it avoids extraction.
Doctor, how root canal can be done?
So root canal treatment basically consists of three major steps. In our terminology, we call it as access opening, biomechanical preparation and obturation. In the first step, we open up the tooth, we drill, we remove the caries. In the second step, we go to the canals and we clean the canals with our small files and chemicals known as irrigants. And once all that is done, we try to pack it back, and that is known as obturation. The root filling is known as obturation. So earlier root canal treatment was a very vast procedure. It used to take up to 3 or 4 visits, but nowadays with the advancements in technology and the materials that we have, most of the treatment can be done in single sitting. Most of the teeth can be treated in a single session. Unless or until the tooth is infected, we can treat all the teeth in a single visit.
Doctor, is it root canal treatment painful?
No, not exactly. Most of the root canal treatments, almost all of them are performed under a local anesthesia. And even before giving local anesthesia, we apply a topical local anesthesia. So that makes even the prick of the needle, it makes it very less, and the patient does not feel anything. And once the tooth is anesthetized, the pain comes to a minimum level.
Doctor, do you need any medicines during or after the treatment?
Yes, because even during the treatment and after the treatment, certain tenderness is common. Light pain after up to 1 week of the treatment is considered to be normal, and to prevent that, we prescribe just mild analgesics, painkillers, and antibiotics.
Doctor, are there any side effects with the medication?
No, not really. There aren't any major side effects with these medications. However, we do take the medical history of the patients, and we also check if they are allergic to any sorts of antibiotics or other medicines.
Doctor, what is the guarantee of root canal treatment?
See, as long as all the protocols are followed thoroughly, as long as each and every step is taken with utmost care, a root canal we can say there's a 100% guarantee for the root canal treatment. It also depends on a lot of factors like the age of the patient, the immunity of the patient, the healing. For example, if a patient is diabetic, the healing takes a longer time. If the patient is old, the healing takes a longer time. But as long as everything, if we follow all the protocols properly, this is as good as 100% guarantee for the treatment.
Doctor, can patients start chewing after root canal treatment?
Yes, they can start chewing, but it's always advisable to chew on something soft and avoid all kinds of hard foods. For example, betel nuts, any peanut bar or peanuts, all such things, whichever puts a lot of pressure on the tooth, it's better to avoid it, because the tooth will be tender, like I said, for 5 days or 1 week, it will be slightly tender. So until this tenderness goes away and a patient gets a crown fixed, it's always advisable to chew on something soft. And we advise the patients to go for a crown, because that crown will act like a helmet. It will act like a protection for the tooth, and it will prevent the tooth from undue forces. It also serves the aesthetic purposes.
Doctor, instead of going to all this, is it better to remove the tooth?
See, a lot of patients come to us, and because of unbearable pain, they insist on extracting the tooth. They say we have severe pain. Please extract the tooth. We do not want root canal treatment. For all these patients, I would like to say that when we are doing root canal treatment, we are saving the natural tooth. We are not removing. And once you extract a natural tooth, the replacement options are either a fixed partial denture or an implant. In either of the cases, the strength that comes with an implant or a fixed partial denture, it's nowhere near to the strength, the biting force that a natural tooth can provide. So what God has given us cannot be matched, that cannot be compared. So even if it is infected, even if it's not healthy, just by doing a proper root canal treatment and removing the abscess and infection, we can save it. And it's always better to save a natural tooth when compared to a artificial tooth.
Doctor, is crown necessary after root canal treatment and what all options available?
See, this is a slightly debatable topic because some dentists feel that not all RC treated teeth need a crown, but if I have to give my opinion, I'll advise almost all RC treated teeth to be crowned. And there's a reason for it, because a crown protects the tooth from any undue forces, like I've said before, and it's always safer to have a covering over it. It also serves the aesthetic purposes. And as far as crowns are concerned, we have different options in them. We have something known as a metal ceramic crown, which has a metal base, and on top of that it's a ceramic. We also have something known as zirconia crowns. These zirconia crowns are monolith, they are single layered ceramic crowns, and it's a very strong material and they come with a guarantee. Other than that, we have lithium disilicate known as EMAX crowns. If you're not going for crowns, then the next option comes as onlays or permanent composite restoration.
Doctor, what all precautions to be taken during or after root canal treatment?
The major precaution, like I have said, is to avoid anything hard, because unless the tooth is crowned, the RC treated tooth will be slightly weak because it loses its water and it loses its pulp tissue during the root canal treatment. So that makes it slightly weaker. So we advise patients not to bite on anything hard, not to chew on anything hard. Other than that, they just have to take care, and many patients avoid brushing. It's not needed. You can brush on that tooth, just don't apply too much of pressure. That's the only precaution. Other than that, it's fine.
Doctor, what are the most common myths about the root canal treatment?
So the biggest myth about root canal treatment is that root canal treatments are not successful. That's not true. Root canal treatments, with all the latest advancements that we have, are almost 100% successful if everything is done right. And another myth that is that root canal treatments cannot be performed in older patients or patients which are medically compromised, like who have diabetes or hypertension. Root canal treatment can be done in any sort of patients, including pregnant patients. Only precaution we have to take is during the medications, and we have to avoid X-rays. That's the only thing. Other than that, for all that also we have alternatives such as apex locators. So we can even perform root canal treatments by avoiding X-rays. So it is safe to perform in pregnant ladies and also any patients of any age, even the medically compromised ones.
Viewers, we think that you got all the details about the root canal treatment. If you have still any doubts, kindly mention in the comment section.